Hey everyone, this is Rick MacDermid with Senior Solutions Group. Happy 2022. Thank you for checking out this video, and if you haven't done so already, please feel free to subscribe to our channel and spread the word. So we're going to talk today about a mid-November CMS, the Center for Medicare and Medicaid Services, released the 2022 Medicare premiums for Part B and for the deductibles for Part B, which is outpatient care. There was almost a 15% increase from 2021 to 2022. So the standard premium for Part B, Medicare Part B, went from $148.50 in 2021 to this month, January of 2022, to $170.10. So a lot of people are really concerned about the rising costs with Medicare. And one of the reasonings that Medicare used, which we talked about in our video that we put out in mid-November, so you can check that video out if you'd like to as well. We did that one kind of on the fly as soon as Medicare released the information. One of the reasons that Medicare used was this paragraph right here. This is through the CMS.gov website from their newsroom. Additional contingency reserves due to the uncertainty regarding the potential use of the Alzheimer's drug Aduhelm by people with Medicare. So they use that as one of the reasons why, in addition to the fact that they artificially held premiums low due to the COVID pandemic in 2021 as well, in addition to rising cost of healthcare inflation. So if we're going to pick up this article here, we're going to have links to this article as well as the CMS.gov article, and we're gonna post those down below if you'd like to read those on your own. So this has been a months-long review that Medicare officials are expected to announce within the next couple weeks. This article just came out today, the 7th of January. We'll notice that the Aduhelm, the drug cost, the annual price tag tops $28,000. Well, just about 2 weeks ago, that price tag was $56,000. And the word was the FDA was getting pressured by the Alzheimer Association to pull the plug on the drug. And when the manufacturer of the drug got wind of it, they decided to lower the price in half. So if Medicare is using this price tag as one of the reasons for this giant almost 15% increase in Part B premiums, well, Shazam, all it took was the potential for Medicare and other agencies to not allow this drug to be authorized to be used as a treatment. So, wow, that didn't happen. That happened overnight. So to have that drug go from $56,000 per person per year down to $28,000, isn't that interesting how they can just do that? So the Medicare tends to cover these drugs, it says, with little fanfare, but this drug is another story. There's been a lot of criticism, a lot of firestorm over this drug. Proponents such as the Alzheimer's Association argue that Aduhelm's success could pave the way for better treatments down the road for Alzheimer's. And we all agree we need better treatments for Alzheimer's. It's such a terrible disease that affects so many people, not only the patient, but the families especially. So one of the critics said that CMS, Center for Medicare and Medicaid Services, has been essentially put in an awkward position by rectifying a grave error made by the FDA when it approved Aduhelm based on shaky evidence. So again, there was a lot of controversy over whether this drug worked, the side effects, but then we come to the cost and the equity issues. So now that the crux of this article really gets into the meat of it, what the issue is Medicare coverage could throw a lifeline to Aduhelm, which is kind of on thin ice whether it's going to be covered or not. That's one of the reasons for this dramatic price decrease, roughly cutting it in half. A number of major health systems, such as the Department of Veterans Affairs, the Cleveland Clinic, Mount Sinai, and Mass General, have already said they're not going to cover this drug. So that forced Biogen to slash the cost in half last month. So the critics are also saying this could bankrupt Medicare, because Medicare Part B, which is not Part D, which is standalone drug coverage or drug coverage built within a Medicare Advantage plan, Part B of Medicare offers drugs that are covered at a clinic, such as if you need chemotherapy treatment, radiation, infusion care. This drug would fit under that classification. So you would not go to a Walgreens or a Kroger or a Walmart and pick up this drug at a pharmacy. You would actually have to go to a doctor or a clinic to get this drug administered. So the critics are saying this could bankrupt Medicare, thus the rate increase of 15% for Part B is one of the main reasons for this increase. So Medicare patients are already facing great financial strain from Aduhelm, even though the drug's not even been fully approved or approved at all, in this case by Medicare. So one of the things that when they were doing the clinical trials with this drug was they had a clinical trial where they would give people MRIs to see the progress of the MRI and the functions of the brain, how this drug affected the brain. So the people who were getting the test for this drug were getting regular MRIs. So under Medicare Part B, if you get an MRI, you're going to pay 20% of the cost of that MRI each and every time, in addition to paying 20% of the cost of this drug, which originally $56,000 now dropped in half. 20% of $26,000 is still a lot of money that this patient would have to pay, as well as Medicare. Medicare Part B would have to pay 80% of that cost. If you're on a Medigap supplemental insurance, it would pay 20%, so the patient would not have to pay the 20% unless they did not have Medicare supplement insurance. So those of you who only have Medicare or don't have a Medicare Advantage or a supplement plan, then you would pay 20% of the cost of this drug plus 20% of the cost of all the MRIs and all the follow-up care. They would have to set up a doctor's clinic to take in the patient. So a lot of the cost for this drug isn't going to be just the drug itself, but all the ancillary costs with the MRIs and the clinic having to make room for these patients. So a lot of this article is talking about this huge cost that is going to affect so many people that are taking this drug. Thus, a lot of the hesitancy with the cost, along with the unknown. Is this drug really going to work? Are we going to approve this drug? And the people that are on Medicare that are taking this drug may not get all the MRIs that the people in the test group got. When they approved the drug, they had to go off the MRIs from the test group. So are we now going to pay for all of these extra MRIs for all these patients that are on Medicare, who otherwise would not be getting all these MRIs, on top of the cost of the drug? So there's more potential risks. And if people who are on Medicare taking this drug have to wait till they're symptomatic to get the MRI versus getting a regular MRI on a regular basis because you're in a test group, pre-symptomatic MRIs versus symptomatic MRIs, there's a big difference. It's like going to a doctor when you have symptoms and you're in a lot of pain and they find cancer stage 3 or stage 4 versus catching it stage 1, asymptomatic. So there's a lot of issues, a lot of costs that could come up with this one drug that are not even associated with the cost of the drug itself, which could lead to more cost, increased premiums for Medicare, increased premiums for Medicare supplement plans who have to pay for all of this. So these Medigap Medicare supplement plans are going to pay 20% of the bill for these costs, and who's going to really pay for that? Do the insurance companies pay these out of the goodness of their heart? No, they don't. So they're going to have to raise premiums. So it's more important than ever for people who are on Medicare, who have Medicare supplement insurance, to look at their coverage options to make sure that you're getting the most value for your plan, because we're going to see more rate increases if this drug really does take effect, in addition to the increased cost for Part B of Medicare. So what we really want to educate people on is there's a lot of factors that come into these different drugs. We're trying to stay on top of this, trying to look around the corner for all of our clients and for anyone watching this video. We don't want to see anyone stuck on a plan that's going to force them to have to pay and pay and pay and pay. So if you're on Medicare Advantage, just be aware that most Medicare Advantage plans pay 80% of the cost for these types of drugs. You would pay 20% of the cost up to a maximum out of pocket, which could be $6,000, $7,000, $8,000 out of pocket if you're on Medicare Advantage. If you're on a Medicare supplement plan, yes, it will pay, in most cases, 100% of the cost after Medicare pays their part, but we may see increased premiums due to this down the road, in addition to regular health inflation. We're already seeing increased costs with Medicare supplement plans. They usually raise the premiums from 3 to 8 or 10% a year each and every year. So we have a snowball effect where the rates keep going up and up and up every year, and then the Part B premium keeps going up and up every year. If you're on expensive medications, that really could affect your pocketbook. We are here for you. We can help you review your plan. Just during this last annual enrollment period, we had married couples come in where we were able to help them save maybe a couple $100s on their prescriptions, and in some cases, thousands of dollars on their prescriptions and their Medicare supplement cost. Don't bury your head in the sand, people. Take action. Don't just assume that you're stuck on a plan paying the extra cost. Feel free to reach out to us at any time at Senior Solutions Group. We are here for you. We are looking out for you. We are taking the extra step to make sure that we're at the forefront of really informing you and educating you. So again, thank you for taking the time to check out this video and check out these articles. There's a lot of good information in them, and we'll have those linked as well. Take care.